Good afternoon, everybody, or good morning from my side too. So it's kind of morning here, and it's a big privilege to be a part of this distinguished gathering at the Media Conclave. And it's really has been fascinating to hear all the views from all these experts on the field. And again, I feel really happy to be here for sharing the same platform and being able to share my views. And I've been taking some diligent notes while you all spoke, and it's really been nice. So a lot of things for me to reflect back on after this. And I will try to live up to the pressure of coming in the rear and to measure up to your standards when I speak. My whole focus, as given to me by Dr. Pari, was to focus on the role of health communication in the post-COVID scenario. But while I speak, you will see that there is a lot of resonance to many of the points that many of you have mentioned and spoken about in the context of social change. This year has been very challenging in many ways, and due to the pandemic, as we know, and we are still trying to draw a picture of the post-COVID world, if there is such a world, post-COVID. And with the news of the reinfections and second waves and the vaccines promising the communities, yes, there is hope out there. COVID in many ways has laid bare to many of the points that you have spoken about, the structural inequities of our society, the structural differences. And it has also offered us an opportunity to look back, to reflect upon, what many of you have been doing right here, to reflect, to look at our media, to look at our communication, to look at our public health infrastructure, to look at the social determinants of health, to look at our sense of responsibility, where does the responsibility lie, and to look at the different levels of policies and actions on an individual, social, and government level. And in this perspective, I think health communication is very key as we are dealing with the last vestiges of COVID. And when you say health communication, I'm talking about a science-based communication because that has become very important in today's world. The communication has to be evidence-based, has to be science-based, has to be generated by some degree of research. And a well-articulated and accurate health communication would help the communities in this scenario. I had noted 6 points to speak about, and one was managing fear, managing uncertainties, empowering people in different ways and so providing hope to them, managing the information tsunami that you all mentioned, the infodemic, promoting a healthy behavior change and behavioral adherence, and the 6th point, managing mental health. I think with the 6 points, health communication can really help a lot in the post-COVID scenario. Through the scenario also, we have been managing fear, fear about the disease, about its spread, its R value, the infectivity, the possibility of getting treatment at different places, access, and the prognosis after that. What happens? Even if you get COVID and you are cured, it's not the end of the story because research is telling us that there are subtle after effects which keep on, that long-term effects on the body. Then there is always this fear about older relatives and family who are more vulnerable. That's part of the story that people have, communities have to deal with and health communicators have to address. Then managing uncertainty about certain parts of COVID in spite of all that is known. It is a novel virus, and that's the reason things are evolving over periods of time. The directives and guidance are changing. For example, WHO a couple of days back took off remdesivir from the recommended treatment. There is different perception about hydroxychloroquine and its use regarding COVID across the nation and across many parts of the globe. So these are uncertainties. Add to that what one of our speakers mentioned about socio-economic uncertainties, job losses, changing profitability of companies. Those uncertainties also find their way to impact health, and health communicators should take note of that. The 4th point, health communication should empower people. We have mentioned the point of empowerment here. Communication has this underlying role of empowering people, of providing hope. So science-based communication can improve people's self-efficacy, their efficacy in trying to take a decision. Because crisis and pandemic like this lead to an erosion in hope in our communities. So there, communication can be a big help. in kind of helping people deal with the sense of loss, how to treat the sense of loss. Again, and as many of you have mentioned, communication can also deal with managing the tsunami, the information tsunami, the infodemic. A massive flow of information is taking place, both accurate and inaccurate. And a lot of you have mentioned about source credibility, about the credibility of the person who is passing on the message. We don't know now what's happening because information is coming to a plethora of media from different sources, from government, intellectuals, health professionals, so-called health professionals, people of influence, friends, strangers, you name them. All this while, my father sends me all these messages and tells me, is it true? Please check and tell me. So it's kind of that, we have to, as communicators, give that sense to the community, which is false, which is a viral claim. They must have a sense of participating. Then again, the important point, which also was mentioned by its speaker, promoting a healthy behavior change and adherence to the behavior. This has always been a challenge to health communication, a challenge which communicators have rose up to, but with limited success. Lack of sustainability, a continuously changing context impact the process a lot. So we have to be on the job and to ensure that people adhere to certain behaviors and take a step. And lastly, I want to talk about managing mental health. All of us have read, heard, realized the massive mental health effects that COVID has unleashed. So in a post-COVID scenario, we have to help people deal with the situation. It's not that we did not have these issues, but these issues have been exacerbated by COVID. And it's not the end of the story because it's not the only pandemic that has to end. There will be many more pandemics to come, and health communication has to work on building resilience of people. So a science-based health communication approach can really help communities in the post-COVID scenario in the 6 points I said from my perspective. That could be many more. Another important role of health communication is even more salient in the post-COVID scenario, which is, as some of you have mentioned, is building trust. We have a loss of trust now in many places. Already we live in a society which is marred with many inequalities, many disparities, caste-based inequality, income-based, and other sorts of things. So communication has to fundamentally address this, to acknowledge the distress that our people are facing, because otherwise we cannot really achieve the point of behavior change. And here the role of the media is key. Health communication, promotion, education, spreading awareness, they rely a lot on media. So when you talk about training of media people to the lowest level, to the community level, that is music to the ears. And all of us who are connected to teaching, training, research, and practice, that's so very important. So, and also one thing that we must realize, in my role, being in practice from before and as a teacher, research and health communication, I've realized that we all communicate health in different ways. All of us are health communicators. So, it's not only a privilege of people with a degree in communication or health communication to talk about health. As you have seen, people share information. So the more and more we pass on the skills of communication, of science-based communication across the segments who are connected to health and other issues, that's the need of the hour. So I think COVID-19 has driven this home, and we need to make science-based knowledge and resources available to everyone. With that, I conclude my brief remarks here, and thank you for the opportunity. It's been really a pleasure to share my views in this forum and listen to your very important views. God bless you all. Thank you.